Hi, I'm Dr. Altaf, and today I want to talk about something that quietly affects millions of people over the age of 60, and most of them have no idea it's happening until they notice a problem that seems to come out of nowhere. Maybe you've been walking regularly for years. You're proud of that habit, you should be, but then one day you notice that getting up from a low chair feels harder than it used to, or stairs feel shakier than they did 2 years ago, or you catch yourself grabbing the wall when you turn around too fast, and your first thought is, "But I walk every day. Why is this happening?" I hear this from patients all the time, and today I want to give you a real, honest answer. Because the explanation involves something most people have never been told about how our leg muscles actually work. And once you understand it, the solution becomes very clear. We're also going to do a simple 30-second test together that physical therapists use to measure functional leg strength. And I'm going to walk you through 4 exercises that directly target what most people's routines are missing. Let's get into it. Here's what's actually happening in your legs as you get older. Your leg muscles aren't just one uniform tissue. They're made up of 2 distinct types of fibers, and they behave very differently as we age. Type 1 fibers are your endurance fibers. They're built for sustained, lower intensity activity, the kind of work involved in walking, light cycling, or standing for long periods. They're efficient, they're fatigue resistant, and they hold up reasonably well with regular activity. Type 2 fibers are your power fibers. These are the ones that fire when you need force, standing up from a chair, climbing stairs, catching yourself when you stumble, or changing direction quickly. They generate speed and strength, not just stamina. Now here's the part that matters. After around age 40, we all begin gradually losing muscle mass. This process is called sarcopenia, and it's a normal part of aging. But here's what makes it complicated. It doesn't affect both fiber types equally. Research consistently shows that type 2 fibers, the power fibers, decline at a significantly faster rate than type 1 fibers as we age. Studies using muscle biopsy data have found that by the time someone reaches their 70s, the cross-sectional area of type 2 fibers can be dramatically reduced compared to younger adults. And this reduction happens faster than the loss of type 1 fibers. This matters enormously for how you function day to day. Because walking, even daily walking, even brisk walking, primarily recruits your type 1 endurance fibers. It's wonderful exercise. It's genuinely good for your cardiovascular health, your mood, your circulation, and your metabolic health. But it doesn't send a strong enough signal to your type 2 power fibers to prevent their decline. That's why you can walk 5 miles a day and still find yourself struggling to get up from a deep sofa. Those movements require power fibers, and if they haven't been specifically trained, they'll continue to weaken regardless of how many steps you log. I want to be careful here, because this isn't a reason to stop walking. Walking is valuable, but for adults over 60, walking alone is usually not sufficient to maintain the functional leg strength that protects independence. You need to add targeted resistance and strength work. And the good news? Type 2 fibers respond to the right training stimulus at any age. The science on this is quite strong. Your body has a remarkable capacity to rebuild and maintain muscle tissue well into your 70s, 80s, and beyond, provided it receives the right signals consistently. Let me show you exactly what those signals look like. But first, let's find out where your leg strength stands right now. This is called the chair stand test, and it's a validated measure used in clinical and research settings to assess functional lower body strength in older adults. The norms I'm going to share come from a widely used fitness assessment tool for older adults, so they're a meaningful reference point. Here's what you'll need: a sturdy chair, no armrests if possible, though with armrests is fine for a first attempt. Flat floor, comfortable shoes. Sit down with your feet flat on the floor about hip width apart. Cross your arms over your chest. When I say go, you're going to stand up completely, then sit back down fully, as many times as you can in 30 seconds. A few things to pay attention to. Stand all the way up each time, don't do partial stands. Sit all the way back down before you rise again. Keep a controlled, steady rhythm. The goal is not speed, it's controlled movement. If at any point your knees, hips, or back cause sharp pain, stop. This test should produce muscle fatigue, but not joint pain. If you have a known knee or hip condition, check with your doctor before doing this. Ready? Go. Stand fully, sit with control, keep breathing, don't rush. Steady rhythm is the goal. You're halfway. Keep going. Good. Controlled down each time. Last few seconds. Stay steady. And stop. How many did you complete? Here are the population norms for reference. These come from established functional fitness research. For women aged 60 to 64, the average range is roughly 12 to 17 stands. Men the same age, 14 to 19. Women 65 to 69, around 11 to 16. Men that age, 12 to 18. At 70 to 74, women average 10 to 15, men 12 to 17. For those 75 and above, women average around 10 to 15, and men 11 to 17. I want to be clear about what these numbers mean and what they don't mean. They're population averages. They tell you how you compare to a broad age-matched group. They are not a diagnosis. Body weight, prior joint injury, chronic conditions, and many other factors influence your score. If you scored below average, it doesn't mean something is wrong with you. It means your type 2 fibers may not have been receiving enough targeted stimulus. And if you scored at or above average, that's excellent. And the exercises I'm about to share will help you maintain and build on that. Note your number. We're going to come back to it. Now let's talk about the 4 exercises. Each one is designed to specifically recruit your type 2 power fibers in a safe, accessible way. No gym required, no equipment needed beyond a chair and a wall. I've arranged these from 4 to 1, with number 1 being the most effective single exercise for rebuilding leg strength at home. Before you start, I'd encourage you, especially if you have any existing joint conditions, cardiovascular issues, or haven't done structured exercise in a while, to have a quick conversation with your doctor or physiotherapist first. Not because these exercises are high risk, but because tailoring any exercise program to your individual health situation always produces better outcomes. Exercise 4, the wall push away. Stand facing a wall, roughly arm's length away. Place both palms flat on the wall at shoulder height. Slowly bend your elbows, allowing your chest to move toward the wall in a controlled way. Then push yourself back to the starting position. That's 1 repetition. Now, I know what this looks like. It looks like an upper body exercise, but I want you to pay close attention to your legs as you push away. As you press your palms into the wall and drive yourself back upright, feel your feet pressing into the floor. Feel your calf muscles and your quadriceps engaging to stabilize you. Your legs are actively involved in this movement, providing the base of support and contributing to the push. This exercise is doing 2 things at once. It's warming up your leg stabilizers, the small muscles around your ankles and knees that are critical for balance, and it's reactivating the connection between your nervous system and your leg muscles before we ask more of them. Do 10 repetitions slowly and with control. Focus on the push-away phase. That's where the most work happens. Exercise 3. Standing knee raise with a hold. Stand behind a sturdy chair and place both hands lightly on the back for support. You're using it as a balance aid, not as something to lean into. Slowly lift your right knee upward. A deliberate, controlled movement, not a swing. Bring it as high as you comfortably can. Hold that position for 2 seconds, then slowly lower it back down. Let me explain why this deceptively simple movement is so effective. The leg you're lifting is working your hip flexors, the muscles that control how high you pick up your feet when you walk. In older adults, weakened hip flexors are one of the primary contributors to a shuffling gait, which significantly increases fall risk. Keeping these muscles active and strong is genuinely important. The leg you're standing on is doing something different, and arguably harder. Your quadriceps, glutes, and the entire network of stabilizing muscles around your ankle and knee are firing to keep you balanced on a single leg. That's type 2 fiber work happening right there. And the 2-second hold at the top? That's where the balance training lives. Your body is having to stabilize under load, which trains both strength and proprioception, your body's awareness of where it is in space. Do 10 repetitions on the right leg, then 10 on the left. If the 2-second hold is too challenging at first, simply lift and lower without the pause. Work toward the hold gradually over a week or 2. That's not failure, that's appropriate progression. One important form note: as you lift your knee, stay tall. Don't lean backward. The instinct is to tilt away from the rising knee, but when you do that, you're using momentum and body position rather than muscle strength. Keep your torso upright and bring the knee to you. Exercise 2, sit to stand. You're going to sit back down in that sturdy chair, because this time the chair becomes your training equipment. Sit with feet flat on the floor, hip width apart, arms crossed over your chest. Stand up fully without using your hands. Then, and this is the key part, sit back down slowly. Don't drop. Lower yourself with deliberate control over 3 to 4 seconds. Here's why the lowering phase matters so much. When you lower yourself with control, your muscles are producing force while lengthening. This is called an eccentric contraction. And research in exercise physiology suggests that eccentric muscle work is a particularly effective stimulus for muscle adaptation, especially in older adults. It places mechanical demand on the muscle in a way that drives remodeling. Some studies have found advantages for eccentric-focused training in older adults compared to purely concentric training, though I want to be honest that the evidence is still evolving and results vary depending on the individual and training context. What we can say confidently is that the slow lowering phase significantly increases the training value of this movement compared to just dropping into the chair. Aim for 3 seconds down. 3 sets of 8 to 10 repetitions if you can. If you need to use your hands at first, that's completely fine. Place them on your thighs or arm rests and use as little arm assistance as you actually need. Gradually reduce the help as your legs get stronger over the coming weeks. Exercise 1, the wall sit. This is the single most effective home exercise I can recommend for rebuilding type 2 fiber strength in the legs. It requires nothing but a wall and your body weight. Stand with your back flat against a wall. Walk your feet forward about 18 inches. Slide your back down the wall until your knees are bent at roughly a 45-degree angle. You don't need to go deeper than that, especially when you're starting out. A moderate bend is sufficient to create the training stimulus without undue stress on the knee joint. Hold this position. Within 15 to 20 seconds, you'll feel your quadriceps beginning to burn. That sensation is your type 2 fibers fatiguing under sustained load, which is exactly the signal we want to send. Your body's adaptive response to that stimulus is to reinforce and rebuild those fibers over the recovery period between sessions. Hold for 15 to 30 seconds if you're just beginning. Over the following weeks, work toward 45 to 60 seconds. Rest, then repeat 2 to 3 times. Why does this exercise earn the top spot? Because it loads the quadriceps and glutes directly and substantially, with your back supported against the wall for safety, your feet firmly planted, and zero fall risk. There's no equipment required, no complicated technique to master, and the effort to benefit ratio is exceptional. For anyone over 60 who wants one exercise to prioritize, this is it. Now let me put this into a practical plan you can actually follow. Do the 4 exercises in order. Wall push-aways first, 10 repetitions. Standing knee raises next, 10 each leg. Sit to stands, 3 sets of 8 to 10 with slow, controlled lowering. And wall sits, 2 to 3 holds of 20 to 45 seconds, building to longer holds over time. Total time, 7 to 10 minutes. Aim for at least 3 to 4 sessions per week. If you're feeling good and your body is recovering well, daily is fine. But don't try to cram a week's worth of missed sessions into one long effort. That's not how muscle adaptation works. Your muscles respond to consistent, repeated signals over time. That's the biology. Consistency matters far more than any single session. If you can only do 2 exercises on a given day, make them the sit to stand and the wall sit. Those 2 alone address the most critical aspects of functional leg strength. Now let me add 3 things that meaningfully accelerate your progress. The first is protein distribution. Your muscles can only rebuild if they have the raw material to do it with, and that raw material is protein. But here's a pattern I see often in patients over 60. Most of their daily protein comes at dinner. Breakfast might be toast or cereal. Lunch might be light. Then a larger protein-rich meal in the evening. The issue is that muscle protein synthesis works best when protein is distributed more evenly across meals. Research suggests aiming for roughly 20 to 30 grams of protein per meal rather than concentrating most of it at one sitting. Eggs, Greek yogurt, cottage cheese, legumes, fish, a protein shake, these are all solid options for getting protein into breakfast specifically. I'd add a nuance here. Older adults generally need somewhat more dietary protein than younger adults to achieve the same muscle protein synthesis response, largely due to what's called anabolic resistance. Most nutrition guidelines now suggest adults over 65 aim for around 1.0 to 1.2 grams of protein per kilogram of body weight daily. If you're unsure what that means for your specific situation, your doctor or a registered dietitian can help you calculate a realistic target. The second is balance training through habit stacking. Leg strength and balance are deeply connected, and improving one tends to improve the other. But balance training doesn't have to mean separate exercises. Here's a simple practice that costs you nothing in extra time. When you brush your teeth, stand on one foot. Hold the counter lightly for safety. Stand on one leg for the time it takes to brush one side of your mouth, then switch. You've just turned a daily habit into a daily balance training session. Over weeks and months, this kind of low-intensity, consistent practice builds meaningful improvements in proprioception and single leg stability, both of which directly reduce fall risk. The third is what to do during periods of illness or limited activity. This one genuinely surprises people when I tell them, but the research is fairly clear. Older adults lose muscle mass during periods of immobility at a faster rate than younger adults. A week of near total rest following a minor illness, a knee strain, or any other interruption can result in a more significant setback in muscle strength than the same period of rest would cause for a younger person. This isn't a reason to push through illness or ignore pain. Please don't do that. But it is a reason to do whatever gentle movement you safely can, even during recovery. Slow sit to stands, brief walks around the room, pressing your feet firmly into the floor while seated. Even minimal muscle activation is better than zero activation when it comes to limiting the rate of decline during those periods. If you're managing a significant injury, a flare-up of a chronic condition, or a health setback of any kind, work with your healthcare provider on what level of activity is safe for you. But the general principle holds: some signal is almost always better than none. Let's come back to where we started. You did the chair stand test. You have a number. That number isn't a verdict. It's a baseline, a starting point that gives you something concrete to measure your progress against. Here's my challenge to you. Do this routine today. Add the protein habit and the toothbrush balance practice. Stick with it 3 to 4 times a week for 4 weeks. Then come back to this video and do the chair stand test again. I want you to see that number improve, because with consistent targeted effort, it very likely will. And when it does, come to the comments and share it. Write something like, "Started at 9, now I'm at 13. I read the comments on this channel, and I can tell you honestly, those before and after messages from viewers are often what keeps other people going when they're tempted to quit. Your progress matters beyond just you. If what we covered today gave you a clearer picture of what's happening in your legs, and more importantly, what to do about it, then I'd love for you to stick around on this channel. Every week I put out practical, evidence-based health content designed specifically for adults who want to make informed decisions about their own well-being. Not sensationalized, not oversimplified, just honest, useful health education. If that sounds like what you've been looking for, hit subscribe and join the community. Take care of those legs, you're going to need them. And with the right approach, they'll be there for you for a long time to come. I'll see you in the next one.